This material is made available to you by or on behalf of the University of Melbourne under Section 113P of the Copyright Act 1968. It may be subject to copyright. For more information, visit the University Copyright website.
Final. Yeah. If you want.
Yeah, I'll just spend about 5 minutes, but I'll get it before the recording starts. Check the recording. Test. Okay, guys. Right. So I'm just going to tell you very quickly. I'm recording this, so for those who are not here, they'll get this information as well. So I've looked through your scope of work. Most of them are pretty much okay, but there's this sort of so I've already been sending some emails out to you, but I'll take that. Maybe it's easier for me to just highlight some of the issues that I noticed. So the first one is that if there are a couple of you who try to put your focus around the materials, all right, specifically on the materials. So I give you an example is that, okay, if you look at disc replacement, say the spinal disc replacement, and then you say that, oh, current material is XYZ, and then you say, you know, I like to replace that material with ABC, right? Okay, now, obviously, it is not a bad project, it is a good project, but what we will end up with is you have very little to show, right? Because, you know, you're just talking about, you know, changing the materials. So, you know, the design aspect is not there. You know, if you do 3D printing and things like that, you end up, you know, segmenting the same thing and then replacing it back with the same thing. So I'd like you to focus a little bit on the design as well, okay, of the specific implant, right? So that you could at least, you know, explore all the skills. So you suggest that I'm going to change the materials, but also, you know, focus on the design. So that's one that I noticed. And so I've said to a few groups that that's something to think about. Okay, so think about the design. Okay. Now the other one is that some of you are too broad. You know, you say that, oh, I want to look at hip implant. Okay, you know, because of bone loosening. Okay, now but some of you are very good at identify a specific implant design and say that, okay, I'm interested in, you know, this implant design. And this implant design have shown, you know, to be useful, but you know, there's quite a lot of failure, and the failure looks like this, and then you want to tackle that failure. So this is very good because you really, you know, look at, say for example, an elbow implant of specific design, and then narrow it down to the type of failure that this elbow implant, and then you have an idea of how to redesign it, or you have an idea to, you know, introduce a new material, right? And, you know, influence the design. Okay, so that will be a much tighter, neater, you know, term paper. Don't make it too broad. Okay, don't come in and say, so I want to replace the material and this is the material, and then you do all the ISO tests on the materials. Yeah, then you have, you know, not much to show. Okay, so in summary, okay, be very specific. If possible, identify an implant design, identify the problems with that implant, and then introduce new materials and new design to solve those problems. Okay, so these are the main thing. All right. Okay, so if you are listening to this at home, yeah, pay attention. Okay. All right. Okay. Thanks.
Thank you.
All right. And if you guys got any problems, just email me. It'd be easier for me to.
Should we expect an email from you, like everyone of us, or is that just your feedback?
Yeah. So I thought, you know, if you wait for me to email out, it may take some time. So that's why I decided to. because they're all looking very similar, and I have no big problems. All right. So yeah, you're not hearing from me. This is the main. Yeah, I think you can identify what I'm saying. Right. So that's unless you have some specific issue, like you really feel you need some advice, just email me. Okay, directly. All right.
Okay, so we will get started with the lecture for today. So this is our first one on applications of biomaterials. I'm going to do 2 cardiovascular lectures, today's one and then one next week as well. So someone emailed me during the week and asked about, so this time last Friday I was talking about the in vitro studies, and someone asked about why can you only implant in a mouse for 1 year and a sheep for 2 years? If we're doing long-term studies, why aren't we doing it for longer in animals? So I didn't actually give you the table when I was talking about the standards, but this is the table that I was talking about. So they always say, take note down the bottom, they're the common times that are used. It's just as a guideline. You can do, if you can justify something else, that's okay. But for mice, rats, and guinea pigs, you go up to 1 year. For the other animals, you can go up to 2 years. Does anybody know why we would only go up to 2 years in animals, or 1 year in the other animals? Pardon? Pretty much their lifespan. So if you have a look at how long the animals live for, a mouse will only live for 2 years. So within 1 year, they are actually quite old in mouse years. So even if we're wanting a device to last for 15, 20, 30 years, it's not really possible to test a device for that long. There are things that we can do to speed up the degradation if that's going to occur, but there's only certain time frames that we can use. I did also find this slide. It then compares mouse in terms of age to where it is to a human. So there are a fair few differences, but you can line it up. This is more to do with if you're doing drug studies and you're doing metabolism, or you might be doing developmental studies, but it just goes to show you can kind of line up a mouse age to a human age. So back to what we're going to do today, cardiovascular devices. So I just had a look for what type of cardiovascular devices there are, and this is the range. We will cover heart valves, we will cover stents, that is it. But it's biomaterials. We're looking at what type of materials are used in these sorts of applications. So it's always thinking about why they're using the particular materials and what application it's for. So I'm not going to go through too much about the biology of a heart, how a heart works. You would have done a little bit of that in you had a case study about an LVAT, and you went through a fair amount of how the blood pumping and all of that sort of stuff. But I guess in terms of a heart valve, our heart has 4 different valves. So the aortic valve, the mitral valve, the pulmonary valve, and the tricuspid valve. So they're the 4 main ones. And if we're thinking about what a heart valve does, what we're trying to replicate what it does, so a valve will open and close around once per second. So that equals to around 40 million times a year, and around 3 billion times in someone up to 75, after around 75 years, their heart valves have opened and closed, each individual one, about 3 billion times. So you are designing a device that's going to open and close very frequently, continuously, and needs to stay like that. So what sort of materials would you use that can withstand that? So while I was searching for this topic and looking at what people have done before, I found 2 really good review articles, and I'm sure that there are many other ones, that essentially summarised. One of them was only on mechanical heart valves, and the other one was about biological, or it did include biological valves, but it summarised the pros and cons of each of them, how a lot of them had failed as well. So these are 7 landmark caged ball valves. So they were one of the first. This one here is actually the first type of heart valve that was used. In the next slide, I've got what all the different types of materials are that were used in them. This Star Edwards, or a version of it, is still available today. So there are 2 types of mechanical valves that you can still get implanted. The Star Edwards one, it may not be that exact design, but it's maybe something similar, you can still get. And then you've got the different types depending on how they are. But have a look at the cage. So this one here, the cage doesn't join. Some of them, or all of them here, have this cuff around it. There were some of the first ones that didn't. This first one that was developed, there is no cuff. So think about how it's going to be implanted. What are these materials made out of? So if we have a look at, so I have in this lecture, there's a fair few tables. The information that I want you to have a look at is here. What are they made out of? Has anybody heard of methacrylate before? Polymethyl methacrylate? Has anybody heard of Perspex? Perspex is a version of methacrylate. So the first heart valve, they had a methacrylate outside. So if you looked on the image before, it was the first one. And then one of the papers that I read said that the ball inside it was also methacrylate. This paper here has said it's a silicon rubber as well. So you've got something that's very hard plastic. How does that get added into or in place of the heart valve or within one of the blood vessels so that it can actually perform as a heart valve? And it also says here for this one, so a sutureless fixation for the cylindrical chamber. I didn't read up, going back that far, there wasn't actually more information, or I couldn't find enough information about how it was sutured in there. But also have a look, it tells you here roughly how many implantations there have been. So for some of them, not very many, getting a little bit more. So after our lovely Perspex one, we moved on to a stainless steel and a cage. So it was made out of, first one on the list here was made out of stainless steel. Then it had a silicon rubber ball moving in and out. Some of them do say what the cuff is, and when I get to one with a cuff, I'll point it out. So one thing, so this is the Star Edwards, which is still available today, or a version of. This is the material that it's made out of. So if it says number 4, so it's an alloy of 4 different types of metals. So the lecture that I gave on Tuesday went through some of the issues or some of the things that we've found from implants and what has gone wrong and what we've learnt from that. One of them said about not using alloys, but when it mentioned that, it was in context of a hard tissue implant. So for a screw or for a hip implant, it's not good to use an alloy. However, there is a type of metal alloy that is used and is still used in heart valves. So why would it be okay to use it in one application and not in the other? So it's going to depend on the different mechanical strains that is put on it. You're going to have a lot of strain on, or a lot of mechanical pressure on a hip implant. Yes? Someone that's walking around every day. A heart valve. You're having a ball that's moving up and down the whole time. If the alloy is strong enough to withstand that, then it may be okay. It's what is needed for that actual application or the situation that is relevant to what materials are used. So the other thing is that on this one here, they moved to a post-mold heat cure for the ball. So it was made of rubber, silicon rubber. Maybe there were pieces of the rubber coming off. So I tried to find out what they actually do for a heat cure, and the closest analogy I was able to find, so it's not exactly the same, but to kind of, does anybody know what a heat mold cure is? Has anybody been to a dentist? They've put in the filling, they've then zapped it with a UV light and it hardens. So you've made the shape that it is. Afterwards you then post-treat it so it becomes harder. So it's not exactly the same as a filling, but it's post being made, they've cured it, they've heat treated it, so then it's become a little bit harder. So becoming a little bit harder, does it then stop its particles breaking away? But it's obviously then not hard enough or not too hard compared to the frame that it's in, that when it moves up and down, it's not pushing the metal out. So this, it's got here that it's still in production, like I said. This paper was published in 2003. So in 2003, it was still in production. And the other review that I read from, I'll see the date in a sec, it still said that it's in production as well. So people are still getting these heart valves implanted. Here's some more types of cage valves. So some of these didn't last very long. You'll note that these ones are made of titanium, so you have a different type of metal. Is that one of the reasons why they failed? This type of design here, one of the reasons that they said it was failed, because the polypropylene ball eroded the titanium struts. So the constant back and forth of that polypropylene ball, over time, the millions and millions of repetitions, was too much for the titanium struts that it broke. So that's why it failed. The one thing that these tables don't have is, and you could probably find it online, what manufacturer or what company makes them as well. Because you'll find that there's a few big players and they may have had a lot of these ones and they've gone through iterations. But a lot of these earlier ones were named after the people that invented them. So a lot of the balls, just to take note, they're silicon or silicon rubber. This one is high molecular weight polyethylene, so another type of polymer. So you essentially had a polymer inside a metal cage. So that's one type of heart valve, so the cage with the ball moving up and down. Another type was the tilting and non-tilting valves. So you've got non-tilting, so they move, these ones, they move up and down in the cage as the blood flows and stops. And then these ones, they tilt and move in and out, I guess quite similar to how a heart valve actually, or if you look at a heart valve pumping, it's not the same, but it's similar. So again, there is one of these, not on this list, but I'll show you a video of heart valves that are still available now. I've only put in for the tilting discs If you really want to see what type of materials are in the non-tilting discs, you'll see them. So this here again is the metal that they had in the other one. So there's a type of metal, and the housing is made of the metal, and the disc is made of different types of materials. Most of the material names are the company names that they give for them. But has anybody ever heard of this one? You have? Yep. What have you heard of it? I'll tell you what it is, even if... So it's a type of carbon. So it's carbon that's been taken through a pyrolytic process. So carbon that has been heated. So some of these valves are made from carbon, quite strong. This type of carbon is similar to graphene. Not quite the same, but it's compared to graphene. I'm not too familiar on the property details of all the different types of graphene, but does anybody, you've heard of graphite? Yep. So the lightweight bikes that are made out of, so I'm not saying it's the same, but it's similar. You've got a lightweight material that has very high mechanical properties, so it's very, I guess, tough, stable, but then also quite lightweight. You will see the way that these sorts of change, these things are different. So that has to do with the angle of how the valve opens and closes, how far up it does, how far down it, I guess, goes. And then that's going to control the blood going through. Then you have your bi-leaflet valves. So this one here, by St. Jude, is one of them that you can still get today. So one thing that I found when I was looking for all of this, and I didn't include it on a table last week that I put in, but one of the issues that, or a reason why some people get medical devices removed is the sound of heart valves. Have you ever heard, you can hear it and you can hear sound clips of people who have these mechanical heart valves, and you can hear, so I'm the sort of person where sometimes little noises, I can't do repetitive noises, and so I can't listen to a clock that ticks. If I can hear a clock ticking, it's going to drive me a little bit. So for me, having a mechanical heart valve, I don't know, I'm having something that is saving my life, but at the same time I'm having something that I can hear 24 hours a day. I don't know. But it is, if it's one of the reasons why it gets removed, there are some people who at the end of the day must not be able to live with it. But that's one thing, so with this bi-leaflet valve, you can hear it clicking. So what are these made of? Very similar to before. You have your carbon-like materials, some titanium as well. Here's one of the first ones where it's got what the fabric is, and I think in the other ones you'll also see a Dacron or Teflon. So we've heard of that before? Yep. So you can make them into very, very thin fibres, and you can make it into a weave. So you're essentially making a fabric out of Teflon or Dacron that is then, that's what the cuff is made from, that is then sutured in and able to help them keep in place. So this is the one that's still available today, and one of the notes they've got there is the housing design that they've got there is virtually the same for the past 26 years. So something that they've developed a fair while ago, so it came out in 1977, is still used today. So I found this video, which I thought was pretty cool, that goes through the manufacturing process. Okay, let me just work out how to... It's not going to do the sound, is it?
Appreciate the impressive quality assurance processes that are utilized to create these life-saving devices. Beginning as graph.
Have you guys heard sound in this theatre before? Pardon? Maybe not in this one? Okay, I really don't know what's going on and I can't make the sound work. So what they're doing is they show you I'll see if I can synchronize it. I want to do the rest of it from the iPad anyway.
Welcome to St. Jude Medical's mechanical heart valve operations in St. Paul, Minnesota. Since the first implant 30 years ago by Dr. Dmitry Nikolov, surgeons have implanted more than 1.8 million St. Jude Medical mechanical heart valves worldwide. That is over 1 million implants more than any other mechanical valve manufacturer. We're going on a virtual tour of the St. Jude Medical facility so you can appreciate the impressive quality assurance processes that are utilized to create these life-saving devices. Beginning as graphite bars, the St. Jude Medical heart valve orifice and liquid components are precisely machined on equipment capable of 1 10,000th of an inch adjustments. The mechanical valve components then proceed to a highly specialized proprietary St. Jude Medical carbon coating operation. This chemical vapor deposition process provides essential strength and wear durability for the valve components utilizing a fluidized bed. The result is a carbon graphite substrate component entirely encapsulated with a pyrolytic carbon coating. This specialized process is unique to St. Jude Medical products. Each of the necessary material properties, hardness, carbon crystal size, silicon weight percentage, and silicon distribution must meet strict specifications. If they don't meet any one of these requirements, the entire coating lot will not proceed to the next major manufacturing step and will be destroyed. The parts are machined again after the coating is applied. Because of the high durability of the components and the requirement to reduce reflection and heat buildup during the cutting, the process utilizes high-pressure coolants and diamond tooling. Next, a mechanical polishing operation removes any slight surface imperfections and provides the final finish for which St. Jude Medical mechanical heart valves are so well known. After completion of the initial operations, there are many workstations where each valve is 100% inspected to rigorous St. Jude Medical specifications. 100% microscopic inspection for visual defects, 100% X-ray inspection for internal component and coating defects and coating thickness, and 100% dimensional inspections to ensure precise matching of individual orifices to dimensionally compatible leaflet pairs. In our final controlled area, the parts are again inspected 100% visually under a microscope and computer matched for the best dimensional tolerances and fit. The final stage of operation is the valve assembly process and inspection processes to ensure quality. The leaflets are inserted into the orifice. Proof-tested and leak-tested, the valve leaflet operation is tested individually before going to sterilization. Then, the orifice cup is prepared and attached to the carbon ring assembly. This process has numerous steps which include cup preparation, machine stitching, valve to cup assembly, hand sewing the cup and flange, and torque testing. Finally, the mechanical heart valve assembly undergoes one last quality inspection before it is packaged, steam sterilized, and shipped. Throughout the manufacturing of St. Jude Medical mechanical heart valves, none of the processes utilized is more fundamental or important than the documentation of the mechanical processes, their operators, and specific materials used. Monitored with detail and precision, these records are retained for 100 years. You have just experienced the reason why St. Jude Medical mechanical heart valves have been the gold standard for more than 30 years. It's because of the dedication of our engineers and technicians to meeting our strict technical specifications, documentation requirements, and the quality control processes in this St. Jude Medical facility. Quality is our top priority because our customers' lives depend on it.
So I liked that video because it gives you information about the materials. It also shows you a bit about the manufacturing process. It shows you how they've sterilized it, and it shows you how important the paperwork in all of this is. So it's one thing to develop all of this technology, but sometimes the paperwork is, well, it is just as important. So it's a heart valve that's still used today, very similar design, if not the same design as what it has been. And you saw how it's made out of carbon, and saw how much goes into making each of the little valves. So they're quite precisely made, but they sure do work quite well. So I've gone through a lot of the different mechanical valves, what types of materials they've made from. So a lot of them are made from the similar materials, and then it comes down to, or why they may have failed, maybe more of a design than a material thing as well. So there's multiple reasons, or there's multiple things to think about. So the other, or another option is biological heart valves. So biological heart valves, as the name suggests, has a biological element from there. Some of the early ones were from cadavers, so they're human heart valves. So I guess if it is a human heart valve from a cadaver, what could be some of the reasons why it's not, or it's hard to produce them from cadavers or heart valves? What may be some of the limitations? So source, you're relying on someone to pass away to be able to do it. What sort of, and I guess it happens with all types of organ donation, particularly if it's someone that's elderly that has died, or if they've died because of a particular condition, they may have heart valves that you can't use. So in terms of a product, is that something that, well, it's good to have it from the same species, because then that helps with rejection, not always, because you're still going to have immune differences. But that's why, I guess, from a product type of view, and to be able to manufacture a certain amount, cadavers aren't probably optimum. So the majority of the biological heart valves are porcine, so they're pigs. So they're pig heart valves. Why would you use pigs? So anatomy-wise, pig heart is fairly similar to a human heart, size-wise. Similar type of valves as well. So you're wanting something to work like a human heart valve does if you're replacing it into a human heart. So you're finding something that is similar. So I've got two of them, examples, and these are examples of two of them that you can still buy. So one of them, have you heard of Medtronic? A very big medical device company that makes a whole big range of medical devices. One of them is the biological heart valve. So here I've taken a text from, they were comparing two different heart valves, and I've taken the text that they used from that paper because it explains also how they are processed. So once you get the tissue, how is it then treated? So it's fixed. A fixative, glutathione, what does that do? It binds proteins together. So even though it's a biological heart valve, it's being treated in a particular way. So it's got fixatives in there. So in terms of toxicity, if glutathione is a chemical that fixes tissue, are you going to want to have a lot of that residue left over when you implant it? Not at all. So that's one thing that you have to do, is make sure glutathione is removed. So it says that it's fixed in 2 stages. So it's fixed with glutathione, and then it goes on to say that it's treated with something that's called sodium dodecyl sulfate, SDS. So it's treated with that to retard calcification. What is calcification? So you quite often see calcification in bones. So calcify, yep. But you can get calcification with soft tissue. So it's the hardening of the tissue, build-up of salts, hardening of tissues. So they treat it with SDS to try and retard that. The other thing, so what, has anybody heard of SDS before? Yep. What is SDS? What do you know it as? A detergent, yep. So a detergent is a surfactant. Surfactant breaks up water and oil. In biology, we use surfactants to lyse cells. So quite often we'll put detergents, if we want to break up a cell and see what's in it, we will use a detergent. That's what SDS does. So the other thing that SDS, it may not be the only thing that does this, but it's one of the things that plays a role. You are taking something that's from a different species and placing it into a human. You're wanting to treat it to help so that you want to limit immune rejection. The patient who gets it is probably going to have to go on some sort of medication so it stops it, but by treating it with SDS, you're lysing the cells, you could be removing a lot of the immunogenic components of it. So you're essentially left with a scaffold, which is extracellular matrix, which is what the heart valve was. No cells are remaining there anymore, it's fixed, so it shouldn't degrade. And then here they've got the stent, so that's the white stuff in the middle, or sorry, in the picture. all of this stuff around here. The stent is made of Delrin. So I looked up what Delrin is. Delrin's a trademark name from DuPont. So it's a type of thermoplastic. Depending on, because it's trademarked, there was only so much of it that I could find online, that they would be information that I could get. But it's a type of thermoplastic. So it's a synthetic material. They've made it into a weave. So the weave is going to be how it gets implanted or sutured into where they've taken the valve out from. So you've got a biologic valve, but you've still got a synthetic material in there. So if there's still a synthetic material, is there still stuff that can go wrong? Really, with any of them, what can go wrong with these sorts of devices? So another example is the St. Jude trifecta valve. And on their website, they went through some of the key features of it. So these are more, some of them are material based and some of them are advantages maybe, or how their ones are different from other ones. So the type of cuff, they describe it being similar to the anatomy, so that's really a design thing rather than a material. The type of material, they say it's a soft sewing cuff, so then that would ease or help potentially with it being placed in there. Depending on the material properties, the tissue may interact with it differently as well. And I guess I tried to find as much information about what the materials they're made of, but if the company has a patent on it, there's only so much you can find online, or if it's trademarked or it's a company secret. But it's another biological valve that is implanted with the cuff around it. Oh, and then this was a different type as well. So different designs. A lot of the big medical device companies, they'll have a number of different types of valves, calling them different things. Each of the valves also have different sizes as well available. Each patient is not going to have the same size heart valve. You need to be able to fit something to the patient as well, because that's going to make a big difference to whether or not it works properly. So the other example that I wanted to show you is called a transcatheter valve replacement. So to me, this looks a little bit like a stent that then has a heart valve in there. I tried to find a little bit more information about this. What I could find was you can get it in Canada. I don't think the FDA have approved it yet in America. So there's only so much information I can find about it. A lot more is in the literature. So you have a metal stent to which the biological valve is then attached to, and then that's implanted, as shown here, into the position that it needs to be. So if you think of, or what may be some reasons, why would you want to have this type of valve that is held into place with a stent as compared to one that needs to be sutured in? So if you think about a patient who needs a valve replacement, it may be a genetic defect. I guess a genetic defect, you may find it when they are a child. So you have someone whose heart is not to the full size, so implanting something that grows with the patient. But then if it's not a genetic defect, what's going to be the reason why they need a heart valve? It's going to be diseased, or it's something is going to happen to it, and the likelihood of them having other types of diseased or diseases or comortalities involved is highly likely. So someone who has a bad heart valve, their heart tissue around where the valve needs to go may not be able to withstand the sutures and having something in place. So something like this may be their option, where it's, if their blood vessel can still take it, it can be inserted like a stent and still have the heart valve in place. So what can go wrong with these? And I guess we've talked a lot about them when we've talked about just general interactions, blood interactions with materials. Oh, I missed the slide, sorry. So I've shown mechanical and I've shown biological. What would you think would be the best one to get is? I thought before I started reading into this that a biological one may be the best, because a biological one is going to have a similar morphology to what our heart valve is. However, people have done studies. What is the best, biological or mechanical? Depending on what age you are, it doesn't really matter. So this is a study. I'm more showing, so someone went back and had a look at patient data between 1996 and 2013 for all patients, or for patients in California who had been implanted with either an aortic valve replacement or a mitral valve replacement. The number of people in here, and that's the only reason why this table is here, to have a look at this. You've got 6,000 in one data pool, 3,800 in another one, close to 10,000, close to 5,000. Comparing the type of valve and then the material that it's made out of. So if you're younger, between 40 and 49 years of age, you're better off getting a biological heart valve statistically. As you get older, the difference of which one is better starts to decrease, whereas they saw with patients between 70 and 79 years of age. So how these graphs are is how long they've been implanted for and the probability of death. So if they're the same, sorry, I got this one wrong. Yes. If you're younger, you're better off having a mechanical heart. Pardon? If you look at the statistics and the number of people that have had them, the older you get, I guess it doesn't really matter. You can choose which one. So what goes wrong? You're putting a material that's foreign, even if it's biological, because it's coming from a different source, and it's been treated, or you're putting in a synthetic. What's going to happen to it? If the actual device doesn't break, and I guess a lot of them these days don't, the earlier ones did, but they've now made improvements to them. But the things that go wrong, thrombus. So these are devices that have been explanted from patients. Where you see the yellow arrows are big blood clots that have formed around it. If a blood clot has formed, is the heart valve going to open and close how it should? The other thing is, particularly patients on mechanical ones, they will go on some sort of antithrombotic, anticoagulant for the rest of their life while they have this. So even though they're on that, there are still, thrombus can still happen. It would reduce the likelihood, but it may also be something that goes wrong. So there are two different types. So a mitral valve, which is a mechanical one, and then you have one of the St. Jude prostheses. So that's all I had for this. So really the take-home message is the type of materials that they're using. Also having a look at the different designs as well. Why have some failed? Why have some improved? So at the beginning of the slide, as I usually do, beginning of the lecture, I put the textbook chapter. So I read the textbook chapter, and I would like you to also read the textbook chapter. This is in addition to the textbook chapter. So I didn't take any information from the textbook, but the textbook also goes a lot about materials, what goes wrong. So it is a good idea, along with this, to read the chapter as well. So with that, does anybody have any questions? If not, I guess it's 5:15 on a Friday afternoon. Everybody's ready to start the weekend. Okay, have a good weekend, and I'll see you guys next week.